Good morning, everybody. Yesterday on my personal Facebook page, I posted something about women who like to work their glutes or develop nice glutes, and they're doing a lot of hip dominant exercises, and how there's a tendency, or it's fairly common but it's not talked about, how these women are commonly diagnosed with femoral acetabular impingement syndromes and or labral tears in the hip joint. So following up on that, here's the thing, and there's been a lot of studies on this, and there's something that's called pelvifemoral rhythm. Just like we have scapulohumeral rhythm, there's a rhythm of how the pelvis and the femur, when they move, they kind of move sequentially or coordinated with each other. So basically, whenever you move your femur or your thigh bone, your pelvis is going to move as well. So it's very difficult to isolate the two from each other, and they need to work together. So anyway, let's say hypothetically your pelvis is fixated or has a tendency or bias more towards one position. Let's say anterior pelvic rotation, the butt sticking out. You move the femur on top of that, and the pelvis needs to move with that femur moving on it. But if it's stuck in anterior pelvic rotation, you're going to create a compression of the hip joint. And so this is essentially what happens when you see a lot of women doing squats, lunges, rear elevated leg lunges, and all these things with extra range of motion. They've got a huge anterior pelvic rotation to stick their butt out, and they're going into deep hip flexion. So they're creating a lot of impingement in general. Okay, so I just want to bring up some of the studies I quickly found online. One of them was by J.Van Houke et al. From a group in Belgium. This is back in 2013. So they looked at the pelvifemoral rhythm in femoroacetabular impingement cases, and what they found was there was an increased posterior pelvic rotation with active hip flexion and range hip flexion, and that makes sense because it's a compensation to get more hip flexion. So if you have hip flexion, you have an impingement, you can't get any more. To get more, you crank the femur back even more, you're going to have to get more posterior pelvic rotation. You get a movement from the pelvis. Okay. So, and then there was another study in 2016, Azevedo et al. It was in the Journal of Orthopedic Sports Physical Therapy. It was last year actually, and what they found was that there was actually a decreased posterior pelvic rotation in femoral acetabular impingement patients as compared to subjects with other hip pain symptoms, and as well as compared to subjects, healthy subjects without any hip symptoms or any hip issues. So compared to those populations, femoral acetabular impingement patients had less overall posterior pelvic rotation. And that also makes sense, just because, let's say hypothetically, the involved side, the pelvis, has a tendency towards anterior pelvic rotation, sticking the butt out. So you're going to have less overall posterior pelvic rotation, okay, because of that bias of being forward. But as a compensation, you're going to have more posterior pelvic rotation when you need to get into more hip flexion, especially if you try to force yourself into a deep squat or pulling your knee to your chest, etc. So anyway, these studies looked at the sagittal plane only, with hip flexion and posterior pelvic rotation. But you guys think in reality, there's other two planes of motion, the frontal and the transverse. So when usually a pelvis is positioned more anteriorly rotation, okay, and because of the way we walk, where one leg is forward and the other leg is back, and vice versa, that's how we walk. What happens on one side of the pelvis, something has to be happening on the other side of the pelvis. So if one side is anteriorly rotated, the other side is most likely posteriorly rotated. So let's say, for example, it's your left pelvis that's forwardly rotated. So the right one would be posteriorly, backward rotated. So this would create a relative rotation of your pelvis to the right. So your zipper line would be facing to the right, or tendency towards that. And then as well as you have the frontal plane, where one pelvis might be higher than the other. One leg might be shorter or longer than the other, etc. So there's other factors to have to consider when it comes to these hip impingement or hip compression syndromes. Okay, so just want to share that with you. Just little brain farts, not brain farts, little brain gems, so to speak, to create brain farts, because we take things for granted, and everyone wants to develop their glutes and have a nice butt, I guess. If you're going to do so, you might as well do it in a way that's not creating more trauma to your soft tissues, and just to create the body that you want to create. So anyway, thank you for watching.